I'm Dr. Ranganadham, Senior Neuro Surgeon, Aster Prime Hospital, Amirpet, Hyderabad. Now the news is getting viral about the surgery of Sadhguru Jaggi Vasudev, the Isha Foundation owner, and he was operated in one private hospital in Delhi for a brain clot. Luckily, the information is that he has recovered very well. He was cheerful, he was joking in the video that is viral. Now, few aspects of the problem what he was operated for was the problem is called chronic subdural hematoma. Now, as the name indicates, chronic, that means it has been there, must have been there for few weeks. Subdural, below the jora. Jora is the membrane over the brain, and below the membrane and over the brain, the hematoma is there. If the hematoma or clot is inside the brain, called intracerebral hematoma, which is much more dangerous, both clinically as well as surgically also. So chronic subdural hematoma generally occurs in people around 60 to 65 years. People who take medications like antiplatelet drugs like ecosprin, clopidogrel for stroke, heart attack, or antithrombotic drugs like those who have problems in the heart valves, deep vein thrombosis in the legs. These are the situations where these medicines are required. In addition to that, people who enjoy a drink on a long-term basis, chronic alcoholics, the protein is at a low ebb in the liver. As a result, the clotting mechanism is again very poor. People who are born with bleeding tendency disorders like hemophilia, they also are notorious for this problem. For reasons we don't know, this hematoma is more common in men and of course age above 60 to 65. And the Sadhguru happened to be in the age of 65 to 66. The reasons are mostly trivial. Many of times, almost 50 number of times, there are no reasons at all. But they mention the reasons are any injury, trivial injury, not a major accident, not a road traffic accident, not fall from the height, a small hit during dancing, or people say even bungee jumping. So these are the things also can produce some movement in the brain. And the blood vessels from the surface of the brain going towards the skull bone called veins. And veins carry impure blood all over the body. These veins can get torn, and as a result, the clot starts. And mind you, the hematoma starts some weeks back, not immediately, and it increases slowly because of various reasons. And as the age goes on, the system is that the brain size shrinks slowly. And because of that, the support for the veins are less. There's the dead space that is formed. And whatever the hematoma, slowly there are chances because of the negative pressure keeps on increasing in size. The symptoms are mostly headache, very intense headache. That's what the Sadhguru had, I was told. A very severe headache for the last 4 weeks. Vomitings, decrease in the vision, walking difficulty, speech difficulty, weakness of one side limbs, lack of control in the urine, or memory deficits, significant memory deficits. These are the symptoms. If somebody at the age of 65, 66, who is on antiplatelet medicine, as I told, had a small impact, he may not remember most of the times, has severe headache and all, and the other symptoms what I mentioned, it's imperative on the part that he should consult a doctor at the earliest, and immediate opportunity, investigation has to be done to exclude or include that there is a problem. Now, why I'm repeating is that it's equally important to exclude the problem, not only confirming the problem. If there is a subdural hematoma, well, that's the treatment I'm going to tell you in the next few minutes. If there is exclude also, the required treatment will be done. So both are equally important. The treatment in most of the situations is surgery. Sometimes when the patient is conscious, is very stable, he has no weakness or anything, with the knowledge of the patient and the family, there are very few occasions where we treat without surgery. On the condition, he will be observed. And very few people, they may get away without surgery. That is very small percentage. Most of the people, there is a surgery required. The surgery luckily is very comparatively, technically small surgery, not very demanding. Two holes are made, one in this region called the frontal, the other is in the parietal. The dura membrane is opened, the blood clot is drained out, and the blood clot is between the two holes. The irrigation is done with saline till the washings are clear, so that the total blood clot is drained out. And many occasions, including people like me, put a drain. So whatever the blood clot that remains in the next 2-3 days, it comes out. So 100% there is no chance of recurrence. Results are excellent. Results are instantaneous. People who are not able to speak within a day, they speak. People who have weakness on the side of the limbs, they are able to walk. It looks really magical. But the subdural hematoma luck part is that it's over the brain, it's not within the brain. There are few occasions there where there are possible complications like epilepsy, fits, infection, or the blood clot can reaccumulate. Reaccumulation ranges anything from 10 to 30%. If there is a blood clot reaccumulates, again the treatment depends upon what is the size of the reaccumulation, how the patient is. If the hematoma reaccumulation is a small one, there are many occasions, there are many reports where they say that we can treat without surgery, repeat. There are certain medications. And those where the clot is significant, again the patient is showing signs of deterioration, not comfortable, having persistent headache, the patient will require surgery again. And this time 2 holes are not adequate. We have to make a formal craniotomy. Craniotomy is making a opening in the skull bone, lifting the skull bone flap, draining out the clot, and the membrane. The reason for reaccumulation most of the times is a formation of a thick membrane below the dura. So that membrane also needs to take out, because the membrane compresses the brain and doesn't allow the brain to come out to the surface. So the blood clots reaccumulates. So this surgery is a little major surgery. Even then the surgery results are so very, very good. But reaccumulation, let's hope and pray that nobody has this risk of reaccumulation. Most important is the Indian population is aging population now. We used to talk about the European countries, aging population. Now we are seeing that phenomena in our country because of the very significantly improved health facilities. By the time India became independent country in 1947, the life expectancy was 35 years. And I'm very happy to say the life expectancy is anything around 70.6 years in 2024. And it's going to increase. It's a very happening part. But at the same time, the problems associated with these ages also, the usage of antiplatelet drugs, the usage of antithrombotic drugs, and the repeated surgeries, and of course, the aging of the brain, which becomes a little bit small, there we cannot avoid. So the chronic subdural hematoma incidence, I'm not giving a bad omen, but definitely the chance that is going to go up. Now, like earlier days, there used to be doctors called pediatric doctors, which are, even now they are there. And they look after the children, as we know, below 12 years. Now the government of India very rightly has thought of starting a geriatric medicine course, those who are above 60 years, those who are called senior citizens. In the All India Institute of Medical Sciences, where I was trained in 1982, there is a ward that has come out called geriatric ward, and there is a course called geriatric medicine course now it's available. And because exclusively for that age group, you need to look after carefully. Their requirements are different, their problems are different, the problems of solving are different, the care also is different. So that also, because after all they are the Indian citizens, so they need to be taken care. So the requirements are going to go up. It's now, as of now, as I told, the 60%, 60 age above population is 14.9 crores, nearly 15 crores in Indian population of 139 crores. And this is going to go up. And the usage of antiplatelet medicines, antithrombotic medicines also are going to go up. So we have to be very vigilant. This is a problem which is eminently treatable. I use the word eminently treatable, excellent results, chronic subdural hematoma. The only issue depending on the issue is when the diagnosis is made, how soon the diagnosis is made, how well the treatment has been done, and what is the time delay, while the patient is talking to the doctor at the time of surgery, or the patient, when the patient went to the hospital, has he gone in a conscious state. If these things are satisfied, the results, I can say, more than 95%. Excellent. So, chronic subdural hematoma is a totally benign, not very dangerous condition. Treatment is excellent. Let's hope that people should take care of this problem and have a wonderful result for a very, very long minutes to come.